Good morning, everyone. Drop your donuts, coffees on the table. Good morning. This is so good to be here. Are you excited a little bit? No? Not yet? It's coming. It's all good. My name is Jakub Tolar. I am the dean of the medical school, and it seems like a very short while ago I was sitting where you are sitting, so I know a little about how it feels. I did one of my residencies here and my fellowship here at the U, and it has been phenomenal. It's been 27 years now, but still I'm living out that energy that comes with it. So every year as new trainees come, it feels like a blood transfusion. I am a bone marrow transplant doc. I'm a hematologist. It is the new oxygen, the new energy that comes with you. You can smile. It's okay. No, very serious. Okay. It's hard as well, no question about it, but you should know that even though it may not feel that way, that we are waiting for you every year. We are waiting for people who can look at what we do, our staff, our faculty, nurses, pharmacists, everyone, whom you're going to meet. We are looking to you for a new, fresh view of what we do. Fresh eyes and ability to deconstruct, perhaps, some things that we do just because we always done that way. So it's waiting for you to be a very dynamic, very equal, very symmetrical partner to us in all of that. It takes an extraordinary person to go into medicine. And I say this with full humility and full respect to who you are and who you're going to become. And we are here to provide an environment that is permissive for you to become the best versions of yourselves. So help us there. The patience, the tact, the ability to act with your heart and with your brain is unique, in my opinion, to medicine. It's an incredible path to, in one way or another, be chosen for, and it's an honor for me daily to be a part of something like that. It's a vocation, it's not a job. So as I reflect on where we are, I always have deep gratitude for people like yourself that have chosen this path, and specifically have chosen this path to occur, at least in part, at this glorious University of Minnesota Medical School. There are several things that I like to think back for myself and for others that may be of some use to you. The first one is, even though medicine is a glorious endeavor, it is, as we know it, based on science and technology. It is not just that. And more today than ever, I think it's important to employ both of your hemispheres in service to your patients and yourselves, because there are many, many things, that are nonlinear, that are non-scientific, that are artistic in what you're gonna do in the operating room, in the clinic office, in the lab, for that matter, and elsewhere. Second, look for a community. This is a team sport. This is a team endeavor. There's no one, if there are, and typically mistakenly formed heroes of the past of medicine, you think of Fleming, Pasteur, others, they don't exist anymore. And they, in my reading of history, never existed in the first place. You will become who you are because of the people around you, not because of yourselves. And despite all the airport books about look into yourself, who you are, I am of the opposite mind. I think you look outside and learn from others and from the challenges around you who you really are. Which brings me to the third one, which is whether you like it or not, you will be defined, as we all are, by things that are difficult. You will be more defined by them than the things that are easy for you. So take it as a part of it. You know, nobody likes call, at least not initially. Nobody likes, you know, to be sort of at the mercy of the system that does at the moment, you know, and some moments will come like that, look impersonal and a little too much business-oriented. Well, you know, you learn from all of this. You learn from your mistakes. You know, if you are like me, you will remember your mistakes from the operating room, from clinic, from leadership, from the lab, and I write them down. You know, I don't know if that helps anyone. It helps me, you know, to re-anchor who I am and what I do as a servant leader of this medical school. The whole endeavor, the whole path is a glorious one. So despite the occasional seasons of suffering and occasional midnights of soul, hold on the optimistic part of it. You still have that in full excess because you, again, have been fortunate to be given the opportunity to deploy who you are in a phenomenal field of medicine. And as a part of all of that, be kind. It's easy to under lack of sleep, you know, after being brutalized by Epic and, you know, having all of these things, you know, happening to you to forget that. But kindness is, while not yet a virtue, it is a prerequisite to most virtues that I know about, you know, being kind to others as an entry point. So we are looking forward to joining you on your path in the next several years for you to become scientific and medical pathfinders in the field of medicine. And on behalf of the medical school, I'll welcome you here. We are very glad you are here. Thank you.
Thank you so much, Dr. Tolar, Dean of the Medical School, for that warm welcome. Now I'd like to introduce Dr. Keith Mays, Associate Dean for Academic Affairs with the Dental School.
Good morning. All right, so somebody knows my neighborhood. If I say good morning, you say good morning back. Good morning. Good morning. All right. Welcome, everyone. Welcome to the University of Minnesota. Some of you are here coming from somewhere else. Some of you are returning and continue your journey, your educational experience. I know that some of the people from the dental school, where are my dental folk at? Give me a little hand raise. All right, thanks. So I know some of our dental students who are now doctors and now doing residencies. I'd like to welcome you and thank you for choosing Minnesota if it's a new spot for you. I'd also like to say that you're entering healthcare at a very unique time. The amount of genomics and robotics and technology and the things that you'll be using to take care of your patients was not there when I was in dental school. And so you have a great opportunity to really determine and to help, as Dr. Tolar said, caring for your patients. How can you improve your patients' overall health? And one of the things that I would encourage you to do is this concept of working as a team. Work with your nurses and work with your pharmacists, work with your dental people, your oral surgeons, your pediatric dentists. They all have something to add that will improve your patient's health. There are many articles and scientific discovery that has shown that there is a link between oral health and overall health. And I would encourage you not to forget the mouth. It is an important vessel, it is an important portal for overall health and the things that affect our patients. There are a lot of studies that talk about how the oral bacteria and periodontal disease impacts low preterm birth. And so it impacts pregnancy. And so there's a lot of things that you all can do to help us improve health, and a lot of things that we can do to help you improve health. And so we are really about, at Minnesota, improving overall health and working in an interprofessional, collaborative manner. And so, as Dr. Tolar says, you are the individuals who will guide that. You will talk to some of your faculty, some of your mentors, some people in practice, and they won't understand how to do that. Because like myself, I wasn't trained in that mode, I didn't practice in that mode, and a lot of practitioners currently do not practice in that mode. But you are the ones that we are looking to figure out how you can work with your other healthcare providers and improve your patient's health. A lot of what we do in healthcare is really not healthcare, it's sick care. And so we are really looking for people who are looking to keep people healthy, looking at population health and all these other markers, social determinants of health, and all these things and how they impact patient care. And so I encourage you in your training while you're doing this residency to explore each other and to learn from each other and to create that pathway and look for that pathway and to become the individuals who will really shape this interprofessional collaborative practice that we are looking for to improve our patients' health, to reduce the cost of care, and to make healthcare overall just a better place. Again, I'd like to thank you and welcome you to Minnesota. Hope you have a great program, whichever one of your programs are. Have a great day today. Thank you.
All right, let me be the next person to welcome you today. Good morning. My name is Dr. Kaz Nelson. I'm a psychiatrist here at the University of Minnesota in the Department of Psychiatry and Behavioral Sciences. And I also have the great pleasure of working with and assisting and supporting all of the residencies and fellowships at the University of Minnesota in a role called the Designated Institutional Official, Associate Designated Institutional Official. And so with that role, I get to plan days like this Orientation Day. And so this will be probably the only time that all of us are in a room together. If you think about it, your programs are going to be doing lots of things over the next year or few years, but we'd never have a chance to come together like this except for orientation. So let's savor it and really squeeze as much out of this opportunity as possible. So we've planned an agenda today that we hope will be extremely high yield. And I just want to promise you that we are not just going to be filling your already full brains with more PowerPoint slides, okay? We could do that, but I just worry that your skulls would actually pop open because they're so full. And so what we're going to do instead is use this amazing opportunity. What is this, like hundreds of thousands of dollars if you were all in clinics or the ORs? That's not where you are, though. You're not there making that money. You're here. So this is like a multi-$100,000 meeting, okay? So what we're going to get out of this time together is networking, interaction, and building connections, because that's the kind of thing that you can only do when you're in person versus, receiving content that you could just look up on a website or something like that. So this is not going to be just giving information to you, content to you. It's going to be real interactive and collaborative. But I'm an introvert, right? And so the introverts in the room that are freaking out right now, it will be done in a way that doesn't feel painful, I promise, because this was designed by introvert with you all in mind. So it will be both interactive and introvert, inclusive, and sensitive. So that's my other disclaimer. So we have, in addition to the interaction, I just want to let you know we are on Twitter. So if you want to be virtually participating in the day through Twitter, our handles are UMNGME, my handle's Kaz J. Nelson, and then if you want to use hashtags UMNGME, feel free. And then I've also been trying to push the hashtag Eat, Sleep, Pee, Lactate with the recognition that we can only do our best work when we are doing those things as well. So that will be another theme of the day, health and taking care of ourselves as we go through this difficult work. So that kind of frames up the theme of the day. All right. So also, we have some fun things for you to do in addition to your virtual participation. We've got a few drawings for cool stuff and money and book and gift cards. I hope you saw the link to the diversity and inclusion survey. We need you all to do this. We're not able to track your participation because it's anonymous, and we really want high quality data. But essentially, we're really seeking demographic factors of the group to represent the diversity of people in this room, so that we can move forward in our institutional goals of addressing any disparities in our training that might exist for our learners, which we know must exist because that's what the science says, but unless we have that data to kind of really represent the true diversity of our trainees, we have barriers in getting there. And so please do that survey, and your name will be drawn for a $50 gift card to the bookstore at random, and it will be announced in the next Resident Fellow newsletter if you do that. So that's another reason, an incentive to doing that beyond the important humanistic, altruistic incentive of advancing our diversity and inclusion goals. And then we also have a drawing for you. In your materials, you saw that there was a scavenger hunt. If you check in at the different tables and complete your scavenger hunt card, you can enter that at the check-in desk for a drawing that will be completed. And then also, the University of Minnesota bookstore over there has their own drawing. And so right before lunch, we're going to be doing the bookstore drawing for a gift card to the bookstore. So those are all the cool things. You could be a winner. There's not that many people here. With all those drawings, probably all of you will win. We'll see. And then, yes, moving on. Okay. Before we jump into our content, here's something really critically important for you all to know. And even if you were already a resident here and going on to do your fellowship, I think you might even recall that this was confusing at different points in time. You are very unique here in that you are hired by the University of Minnesota in your residency and fellowship, okay? So why is that unusual, or why is that confusing? Many of your colleagues at different residency and fellowship training sites are hired by a hospital, you know, St. Mary's Hospital or you know, Happy Cove Hospital, you know, that kind of thing. They're hired by the hospital to be a resident in that hospital. That is not what we did. You all joined programs where your employer is an institution of higher learning, the University of Minnesota. And of course, we work with different training sites, different hospitals that you're going to be doing clinical care at. A big one that many of you will participate in, but not all, is the University of Minnesota Medical Center. And you might have heard that we're trying to move in a little bit closer in a joint clinical enterprise or a partnership with that hospital, but that does not mean that they're your employer. So please keep this in mind, and this will be a theme through the day, that you are employed by the University of Minnesota. So if something comes up at one of your sites, you also have to kind of let your team, your program team, or the attorneys, or whatever it may be at the University of Minnesota know that something is going on because they're your employer, all right? And when you fill out forms, the forms will say, what hospital employs you? And that'll really mess you up. Like, oh, I'm not employed by a hospital. How do I fill out this form? You just always put University of Minnesota, University of Minnesota, University of Minnesota, okay? So welcome to the University of Minnesota, and we pay your paycheck, so we are your employer. All right. Good news, Dr. Susan Cullican is here. She started last week, and she is the new Associate Dean for Graduate Medical Education and the top dog of residencies and fellowships, the designated institutional official. And so, Dr. Cullican, if you could, welcome Dr. Cullican to the jog. So, Dr. Cullican's a pediatric ophthalmologist and will be leading our programs into the future at the University of Minnesota. So she and I, in a partnership with the rest of the graduate medical education team, are responsible for oversight and compliance and ensuring the quality of the training that you receive and the quality of your clinical learning environment. It's a huge job when you're at a million different sites, but we've taken that on and we're delighted to do that.